Hi, I'm Linda McGoldrick. I've worked in the healthcare field internationally for over 30 years in both providers and life sciences companies. Following undergraduate, I have 2 master's degrees, a master's in social work and healthcare, and an MBA in finance from the Wharton School. Both are from the University of Pennsylvania. I have worked for a number of companies, large companies, global companies, pharmaceuticals such as Glaxo Wellcome, SmithKline, Johnson & Johnson, Kaiser Permanente and Kaiser Permanente International, voluntary hospitals in America, most of the large academic medical centers in this country and throughout Europe, Access Shield Group, Norwegian device company. I've had executive roles with Shearson American Express, Marsh & McLennan Companies. The boards I've served on include Charles River Laboratories, Bayer Healthcare, Vios PLC, Access Shield Group in Norway, Rondal Technologies, Vocera Communications, and several government appointments from the Minister of Health in executive board advisory roles. My expertise over most of my career has been very much strategy, new business development, new venture development, and new market entry. I have spent about equal time on the provision as well as the supplier side, working with FTSE 50 companies and startup companies. I think understanding all the spokes of the healthcare wheel is essential in the world today. It is very much a global perspective and strategic perspective. I have deep knowledge in several sectors within a healthcare umbrella. Certainly on the provider side, large hospitals, managed care organizations, behavioral health, long-term care, psych and rehab. And on the supplier side, pharmaceuticals, diagnostics companies, device companies, wound care, and companies that are integrated in looking to health technology, health IT, and quality outcomes. Over the years, I've worked closely with the investor community, institutional investors, size private investors, investment banks, looking at specialties, subspecialties within the healthcare arena, doing primary and secondary due diligence, some merger and acquisition advisory work, and helping drill down on some of their current investments or prospectively future. For years I've worked internationally, and I have very good relationships with Greater Europe, emerging markets, India and China, particularly now as in M&A and structuring partnerships, public-private or private-private. I think that those contacts, both at the individual company, senior executive, and ministerial levels are critical to really understanding what's going on in these markets. My management style is, I suppose, very transparent, direct, non-political, and somewhat consensus-driven. My entire approach throughout my career has been bring the best and the brightest around the table, create the environment to have a rigorous debate, and move from there. I'm interested in a CEO role with a product or services company of any size, startup, mezzanine level, mid-cap companies. I have a particular passion on companies that understand a larger context and application for their products and services, and have become intricately involved with the clinical trials, product approval, and regulatory environments in multiple countries.